everyone, I am Singh. I welcome you to Read My Story, where I interview authors, speakers, coaches, celebrities, entrepreneurs, and more. Today I have with me Dr. Richa Saxena. She is an MBA, MD, and a gynecologist with nearly 15 years of academic experience. Besides being prolific author of more than dozens of medical books for undergrads and postgrads medical students, she is an avid reader, engaging teacher, revolutionary thinker, exceptional doctor, enthusiastic medpreneur, able administrator, exceptional leader, and ardent promoter of women's health. She is the recipient of Rotary Vocational Excellence Award for her exemplary services in the specialty of obstetrics and gynecology. Despite her physical health-related problems, she has also received the Women of Substance Award Healthcare category in the year 2022 for promotion of women's health through online patient education and telemedic consultation. She has recently introduced an online platform which is Let's Talk Women's Health. Today she will be discussing with us about her life journey. So let us hear from her. Welcome, Dr. Richa. The platform is open and now over to you.
For such a great introduction.
Privileged to have you on our platform. So first thing first, I'd like to know from you, like how your personal life, like past life, has affected the person who you wanted to be in your life and what you are.
Okay, so I actually always wanted to be a doctor, and fortunately, I am an obstetrician gynecologist today. But again, life is never simple, and it was not simple or easy for me as well.
Right.
So I did my MBBS, I did my MD, and with the aim of acquiring higher education in obstetrics and gynecology, the highest qualification is known as a degree called MRCOG, which stands for Member of Royal College of Obstetrician and Gynecologist, and this you acquire from London.
Okay.
So to acquire this degree, I had, it was I think when I was in my late 20s. Mm-hmm. So that was the time I went to UK to get this degree. But again, like I told you, life is not always simple and it doesn't give you what you are desiring.
Correct.
So I suffered from serious illness when I was in UK. And as a result, I suffered from severe illness. In fact, I suffered from a stroke. So that affected the left side of my body. Stroke is like a brain attack. So it's a clot which develops in the vessels in your brain. Right. And because the nerve cells, they die, they will not come back. So it kind of causes paralysis and other things.
So my left side paralysis.
Yeah, left side was affected, and I was hospitalized for quite some time. Initial 3-4 months, it was very bad. And later, when I kind of recovered, it was more of physiotherapy, which went on for 3 years and so on. So it was more like a struggle for survival, and at that time I was not even thinking of anything else. It was more like, becoming independent, doing everything on your own, learning to walk, learning to do activities of daily living. It was that. And then once I kind of became independent and I was able to do everything on my own, that was the time I started thinking about, now what next to do.
Right.
Because I realized I am a obstetrician gynecologist, so my work also involved a lot of surgeries and a lot of work.
Yes.
Which now I realized I may not be able to do it with 100% perfection. So then I decided, because whatever you do, it should be with 100% perfection. Correct. Otherwise, I don't think it is really required to be done, or it should be done. Yes. So So with that in mind, then I kind of moved into academics, publishing, book writing, research work, and I kind of started writing books for medical students, for postgraduates, as well as undergraduates.
Right.
And initially, there was somebody who gave me a kind of, I can say it was the best compliment I ever got, that when you are a doctor, you are treating only one person.
Correct.
But when you are a writer, you are kind of treating so many people. Like a seed will give rise to so many fruits. So it's like when you are, and that is something which I was like, yeah. So it felt good when I heard that. And with that, then I also started an online training program wherein I train the candidates who are preparing for the MRCUG exam.
Okay, great.
And so I keep having webinars and I keep having online training sessions pertaining to that. And that should also going successfully.
Wonderful.
So, and then with the advent of COVID and with the advent of telemedicine, again with that thing that, I have to give back to the society in some form.
Right.
That was always there. So I kind of now I have moved into a platform. I have kind of moved into constructing a platform which is by the name Let's Talk Women's Health, and that is basically based on the concept of 4 E's, which is empowering and enlightening women through education and e-consultation.
Great.
So it's like a virtual health clinic which is on my website www.drrichasaxena.com, and I am also involved in taking multiple health related webinars and multiple health related events, workshops for women.
Wonderful.
For teaching them, basic things which they need to know so that they can keep various illnesses away, or if they have any illness, then how to deal with them.
Right.
Questions and simple lifestyle.
Wonderful. So you mentioned about your health, like when you were in UK, you got paralysis attack. So I'd like to know onto that like you mentioned that you took 3 years almost to get yourself recovered, and that includes medication as well as physiotherapy.
Yes, and plus there was a time when they told me that you take antidepressants, because obviously this was nothing which I had ever expected. I had gone there with the aim of having a degree, and suddenly the whole thing comes down topsy-turvy. I mean, the whole life changes for you.
Right, and you had to drop your education which you were gone through.
Yeah, at that time the focus was more on recovering and less on. I had cleared one part of the MRCUG when I was in India only. So to give the second part, I'd gone there and to kind of practice.
Right.
That was kind of not possible. But and the focus was more on survival. So I did that, and then that also taught me several things. One is don't give up in life ever, because life will give you problems. So you have to fight with it, and you have to think about a creative solution to deal with those problems.
Right.
Like they say that when life gives you a lemon, you make a lemonade out of it. That's exactly what happens. This happens, and you will have to deal with it in some way or the other.
That was really an inspiration for many people. Like this situation may happen with anybody, and if you are having a thought that you want to get cured and you do your own effort, definitely you can come out of that. That is so inspirational on your part.
Because there was a point when I actually fought with the medical staff there. They wanted to give me antidepressants. That and I said, no, I don't want it. I'll manage without it.
Correct.
It's your willpower which helps you fight, because everybody, it's not just me. I think everybody will face sometime or the other in their lives. They will face some problems, which require a lot of willpower and a lot of determination. So,
great. It was so great to hear about that. That's so inspirational. So if I talk about the things you are passionate about in your life, so what are those things you are passionate about?
So what I just told you, that with the advent of COVID and everything, it it caused me to think deeply. And then that was the time when I actually thought, this is the time I need to serve or give back to the society in some way.
Right.
And that is the time when I kind of visualized this initiative, which is, I've termed it as Let's Talk Women's Health. And the reason why I've termed it like this is, it is not just treating women or giving them consultations. It is also about educating them.
Correct. Awareness is the main problem, which I also feel sometimes is the big issue. Most women are not aware of these issues.
And once the woman is healthy, she'll also be able to take care of rest of the people in the family. So that becomes important. Her children, her spouse, other elders in the family. She'll be able to deal with the health issues which those people are also facing.
True.
If she is aware about the healthy lifestyle, she can teach her children also about a healthy lifestyle, or how to avoid illness.
Right.
So I think that is the reason why I got more inclined towards educating women, because that is something which, again, education and academics has been a strong part. So I thought that the best way I can contribute in my way to the society is through this.
Right.
So that is the reason of
that is so wonderful. That is so wonderful, because the treatment is one aspect of your field, but the most important aspect I feel still is the education part, the awareness part, which is missing. And you are working on this, and people like you working on this field altogether will definitely help in a way that women would start being knowing their health related problems. Not only knowing, but they would start taking care of their health related issues as well. That is so wonderful.
Because so many problems, they are kind of related to your lifestyle. So all of us know that obesity, it's a common thing which is coming up.
Yeah.
Because people are not exercising, and they have that lifestyle, the lazy lifestyle. So if you take care and if you take control of these simple issues, you will be able to deal with so many health related issues.
Right. And we would be discussing about these issues later further. Now I would like to know more about about your work and experience, how you started, what all you did, what kind of books you write, so all of these things.
So the books I've written, if you want to get more details, you can check my website, but it is more like I also told you that I am having this online course for MRCOG.
Right.
So I have books, because this exam, it comprises of 3 parts, part 1, part 2, part 3. So I have books which I've written on the 3 parts of the exam.
Okay.
So, and they are running in their 2nd and 3rd editions. So that's what they are kind of doing considerably well.
Great.
And besides that, for undergraduates, the students who are just doing MBBS, or those who are doing their post-graduation, that means those who are doing MD, for those both the kind of students, I've written books. And
you are teaching also?
Yes, I think I mentioned that. Yes, I mentor. I am kind of the mentor and the course director of a course which is pertaining to teaching the candidates how to pass their MRCOG exam.
Right.
And the irony is, this was the exact exam I had kind of once, thought of kind of clearing, and now here I am, teaching so many students to clear their MRCOG.
Wonderful. Like you are helping other people to fulfill their dreams.
Yeah.
Wonderful. So if I talk about the vision, mission and goal in your life, what do you think from now to next 5 to 10 years, what do you want to do with your vision, mission and goal?
So vision, like I have been, I think, telling you, it must be clear by now that I visualize a world where women are healthy.
Right.
And the mission is maybe to be able to kind of, if I can educate, maybe say, 1 million women I can educate in coming 5-6 years, I think that'll be a great achievement.
Wonderful.
And I can help them take control of their health related issues. I can treat them and I can educate them.
Correct.
And the goal, I just told you that I am kind of working on launching this virtual health clinic, and I'm just hoping that this will be successful and I am able to, achieve what I am thinking of from this.
Definitely, you would be successful in that, and more people would also join you to help you out in your mission, and definitely that would be a wonderful thing for you and for all the audiences, like those who would be benefiting out of.
So thank you for your wishes.
Sure. So if I talk about the most important lessons you have learned from your life, maybe from personal or professional, what are those things?
So like I just mentioned, the first lesson I would like to say, and everybody, and especially the younger generation,
right,
never ever give up in life.
Correct.
Life will have problems, so don't give up. That's the first thing. And second thing I would like to say is, don't be afraid of failing.
Right.
If you want to grow in life, you'll have to try and do something different.
Correct.
And when you do something different, obviously you have to come out of your comfort zone and try and do something different. And obviously there are chances you will fail, which is okay. The important thing is to learn from your mistakes.
Correct.
And then second time when you try, and don't give up, so keep trying. So second time when you try, you correct those mistakes, eventually you will succeed.
Definitely.
That is the main thing I have kind of learned in life also, and that is what I tell other people also.
Because unless you try, you would not learn.
And to try you will see, failure is just the next step towards success. What is more important, what they used to teach us even when we were doing our medical training and all that, if you, like when you are doing a surgery and you by chance you perforate or you cut something which you are not supposed to, how do you know how the feeling is? Suppose you have done an error, that is fine, but you have not recognized it and not corrected it, that is not fine.
Correct. And in your field, the error is could be a big blunder. It
could be fatal also. So error, everybody is human. You are, you will do. It is human to commit a mistake. Correct. But not to learn from it, that is what is
that is wrong. The biggest mistake in life.
Yeah.
So moving on to the core theme of our discussion today. So I would like to know from you, like, what are the common health related issues faced by women in general?
So women in general, I think they are affected by illness starting right from their adolescence to the reproductive age, as well as the time when they enter the menopause.
Right.
So it's kind of multiple problems. When they are young, they may have several menstrual abnormalities. Then when they are in the reproductive age, they might be suffering from things like infertility, very common nowadays, PCOS. Then when they are in their childbearing age group, pregnancy related several issues might be there. Then again, as they head towards their 40s and 50s, they can also encounter several malignancies, cancers, several types of cancer. Mm-hmm. So, and then of course the menopause, which is a transition for the women, and they might face several psychological issues or maybe very physiological issues.
Correct.
During the time. Mm-hmm. So what I kind of emphasize is that lots of these problems, they can be dealt with if women, they know once they are educated, they know why they are going through all these problems. So if you know that why this problem is occurring, you will not be so distressed, or you will not be so psychologically affected. One is that. Second, lots of things, like even many kinds of cancers, they can be prevented if you adopt a healthy lifestyle.
Right.
I'm not saying that if you have a healthy lifestyle, you'll not have problems.
But probability of
avoid it to a great extent if you
probability would be less.
Yeah. Mm-hmm. Then again, like I see lots of young girls, 19, 20, 25, PCOS is so common in nowadays in the girls and in young women. And simple thing like weight reduction, if they can just control their weight, that will be able to kind of bring the endocrinological imbalance which is occurring in them back to normal.
Right.
They probably may not even require medications. And just educating, and lots of women, they are fine once they reduce weight. All their issues, all their problems, they are solved.
Correct.
And similarly in pregnancy, what I have encountered, things like, especially in our country, iron deficiency anemia. And taking simple precautions. What I tell women, simple precaution like cooking food in iron kadhai, it may help you deal with this.
Right.
So if they know about this, and lots of them don't know about it. They are like, अच्छा, इससे ठीक हो जाएगा, like बिल्कुल ठीक हो जाएगा. So these kind of things.
Right. So if I talk about these things you have just mentioned, how women can deal with these such issues, and if they change their lifestyle to some extent or maybe fully, would that help them to be healthy, and how they can make the shift?
See, I think nowadays the lifestyle is very sedentary. We are not incorporating. I mean, it's more like a luxurious lifestyle. We don't indulge too much in walking, or everything is
like within the home only. Everything, whatever you are doing within your home.
They are, no physical activities, very, very less.
Correct.
If you call a cab when you want to go out. Earlier, we used to walk down. If it is 1 kilometer, people used to walk down. And now it's like, let's call a cab.
Correct.
So that kind of sedentary lifestyle, if that can be taken control of, and you don't have to do much. I mean, nobody is saying that you hit a gym and you do all kind of weight building exercises.
Right.
Taking a simple walk, half an hour, but every day, and preferably at the same time. That will work. That'll keep you active, and it can be maybe early in the morning or it can be late in the evening, whatever suits you. Again, the lifestyle, basically avoiding processed foodstuffs, and by processed I basically mean the things which are more tasty. I mean, cheeseburgers, pizzas, all these are processed food. But the problem is anything which is containing processed food or which is containing maida, that is not going to benefit you.
Correct.
So eating something which is made up of whole grain like brown bread or the whole grain cereals, that is something which is likely to help you. Then incorporating more of fruits, the raw fruits and vegetables.
Right.
Or incorporating more of white meat. If you are a non-veg, then white meat rather than the red meat.
Right.
White meat specifically, rather than chicken, the white meat, the fish, that is something which is a very rich source of proteins as well as a very rich source of omega fatty acids.
Correct.
Which is again very helpful for you. So taking simple things like this, I think will help you to avoid sickness.
Right. And these days what trend we see is taking supplements and multivitamins is also a trend these days. Does this help?
I do not recommend lots of multivitamins. Maybe after the age of 40, men, women, both age need to take calcium, vitamin D, because again this is encountered and this may affect the bones.
Right.
And speaking of bones, osteoporosis is a very common problem encountered in old age men and women.
Like joint pains and all?
Fractures.
Okay.
Specifically the fracture of the hip bone, because this is a very common cause of morbidity and mortality. See, I'm trying to use as less technical language as possible so that people can understand.
Correct.
So weakening of bones may make them more prone to develop fractures.
Right.
And some fractures, they might be life-threatening in old age also.
Correct.
So,
we have seen these kind of cases wherein falling from falling while walking, and they just fall that was not that big enough, but still they got fracture in their hip, which result in like other illnesses as well.
Because see, if the bones are weak, even a small minor fall will result in a fracture.
Right.
And the problem, the hip joint, the area of the hip joint is an area which is quite prone to this fractures.
Correct.
And the only treatment available is surgery. I mean, you cannot treat it by applying plaster.
Correct, that cannot be possible.
The surgery in old age would be associated with several complications because old age as it is, they might be having, some underlying comorbidity. There could be some heart illness or there could be something else. It could be diabetic, hypertensive.
Right.
So then that would result in further complications.
Correct.
So we were talking about supplements. So I recommend people to take calcium supplements and vitamin D supplements. And if not supplements, at least increase it in your diet.
Okay.
For example, milk and eggs, they are very good source of calcium and vitamin D. So at least vitamin D and calcium in form of diet, if you incorporate it, you may be able to deal with all these problems.
Right.
And otherwise, during pregnancy, except for folic acid, no other supplement I recommend, especially in the early pregnancy. Towards the later part of pregnancy, they can take iron and they can take calcium. In Indian scenario, majority of women, they are prescribed calcium and iron tablets.
Right.
Because our circumstances are such that majority of women do develop iron deficiency anyway. And even after delivery, they need to take that. Otherwise, I usually do not recommend more of supplement. If you take a good healthy diet which is rich in proteins, I don't think supplements.
Right. Better to have like fruits and vegetables in raw form.
A very good this thing is yogurt, curd, dahi. Okay. So that is very good. 5 portions they say of fruits and vegetables every day. That is something a healthy diet should comprise of.
Right.
And avoid taking processed food stuff. That is again something
which is like really dangerous for our health. We don't understand it now, but later it is affecting us a lot. So now moving back to you again, are you an introvert or an extrovert kind of a person while facing your audiences? And what do you think that is like having pros and cons?
See, I am a very big introvert. It's difficult for me to face the camera, and to tell you the truth, I'm actually very nervous before all my interviews or all my talks. I still have butterflies in my stomach. Even though after several interviews and after several this thing also, I do have that thing that, that tension. Arey, wo interview hai.
I can understand that happens sometimes.
So, and again, when I started taking teaching sessions for MRCG, I had this is not my comfort zone, talking in public or teaching. Correct. I had to get out of my comfort zone to address this issue. But still, I don't think 100% I've been able to address it. I'm trying. I'm still kind of getting there.
Definitely.
And I think it has affected me because sometimes I'm unable to put my point across to the audience. Sometimes, at least it used to happen previously. I don't think it happens anymore. But initially I faced lots of problems because I felt I was not able to bring across my point to the audience.
Correct. To everyone's interest, I'm marking one thing here, that constant practice of yours help you improve and like be more confident, and that is the key actually. I also did in the same way. I was also kind of nervous initially. I was also like facing problem in facing camera, like speaking in front of audience. Practicing it helps me. So definitely anybody and everybody who is facing challenge in that area, that only thing which can help you is practice. That's it.
Yeah, I would agree with that, because initially when I used to take my teaching sessions, one day at home I used to practice the whole day, the same presentation.
Correct.
I would speak out loudly and I would practice. So I think that helped.
That always helps. So if I talk about the kind of support you got in your journey, who all supported you, and what span of time, like when they supported you?
So as I had been, I think, talking about my illness and my problems which I faced when I went to UK. So it was mainly my parents who helped me throughout my journey, and they were so supportive. They still are actually.
Correct.
And they've always been, in fact, all my values, all what I think, or all whatever life lessons I've learned, it's through them only. They have kind of trained me, or they have kind of instilled those values in me that, and it was just them, because at one point I was that, now what am I going to do? So they were like, no, you just start doing something, and we're sure you'll, achieve, reach something. And probably that is what helped.
Definitely. Moving on to the next one. If I talk about the kind of inspiration and motivation in your life, how you got that inspiration and motivation?
So I actually get inspired by every small act of kindness or selflessness which I see. And I think we had several such examples during the COVID times.
Right.
We had several common people, doctors, police people, nurses, healthcare professionals, even common general public, just helping out, because there was so much crisis and there was so many problems, and there were so many examples that individuals reaching out just in whatever way they can help. Not somebody very big or somebody very rich or any common people you could see, helping the other person deal with the situations.
I agree with that.
That was something which kind of inspired me that, as a doctor, I now need to do something for the society. Now I've reached a level that I've been blessed enough by God. So I think now I can kind of contribute my way to the society. And that was the time when I kind of developed the plan or formulated that I'll go ahead with this initiative.
Right. And this is really wonderful that you have taken this initiative. And awareness is the key. Like I always say, helping in a way is one big thing, but spreading awareness is the biggest one, I would say. Because when you help somebody, you can help only the few ones. But when you start to spread awareness, you help many people to get aware of the thing. And they can change their life only by getting aware. This is a big thing. So now we are moving on to the next one. I'd like to know from you, what is your take on success and how does it look like to you?
See, initially when before I when I just had graduated and when I just finished my MD and I had plans of studying abroad and all that, that time success was more of, how rich you can get in life, or, how many surgeries or what post. Now I don't think it is anything like that. Now it is more like how many people you can make happy, how many people you can make satisfied, how many people they bless you invisibly, how many people, they feel that they got benefited from your consultation or from the book, how many people got benefited from your consultation, or how many people they got benefited from the stuff I wrote, or how many people were able to take care of their families because of the awareness session I took for them. So it's mainly like that.
And
no longer about money or materialistic things. It's more about the blessings, and it's more about how many blessings and prayers you are getting from other people.
Kind of purpose to life. This is what makes you happy. Wonderful. Now we are moving on to the last question. Any message, advice you would like to share with our viewers and listeners?
I just read it actually on WhatsApp today that in a lane called life, you will never have a straight path, and you'll suddenly have people crossing your path without giving you signals. And this is actually what life is about. And this is exactly what life gives you. At the time when you expect the least, you'll have something, and you'll have to just deal with it. So, and think creatively, and you will be able to deal with the issues.
Definitely,
facing.
when you be creative with anything, you got to have resources all with you. You got the opportunities, you got the resources, and you got the support as well. So being creative is one big thing. I must say, it was wonderful talking to you. What an amazing insights you have shared about so many things, and the story you have shared about you was also inspirational, related to your health, and I think that will help many people to understand that being sick is one aspect of the thing. The second aspect is how you understand this and how you take charge of your situation and the outcome you look for and how you come out of that. That is the big thing, and that is really inspirational. And the kind of awareness related issues you have shared about women's health and the kind of lifestyle change that can benefit them, that was also wonderful thing, mind opening. And I must say it is really wonderful to understand about these things on a right time, basically, that will help you to understand these problems and take your life in a better way. Maybe the suggestions you have shared can help them out to have a healthy life. I really enjoyed our conversation and looking forward to hear more from you again soon, maybe on some other topic, maybe some detailed one. Thank you so much, Dr. Richa, for your time. It was really wonderful listening you.
It was really nice to have this chat with you. Thank you so much.
Thank you. It was our pleasure, and benefit to all the audience there. I'll also share your social media and website links so that people can be in touch with you. Like women can be in touch with you and take your help, guidance, advices, and the knowledge you share that can help them. And thank you so much, guys. Don't forget to check that out too. Thank you very much, everyone, for watching and listening. I hope you all must have gathered a lot of information and enjoyed watching it. Don't forget to like, share, and subscribe. Have a good time. Thank you, and bye bye.